everyone, this is Jennifer Landry with Gowan Consulting, and today I'm going to be talking about exposure therapy. Adults with PTSD or anxiety may find themselves avoiding things that remind them of the trauma they experienced or that caused them distress. They might avoid places, situations, objects, or people, or they might avoid thinking or talking about certain things due to distress. Unfortunately, this type of avoidance will only serve to keep the distress and anxiety going and possibly amplify it. Because they're anxious, our clients might avoid situations, and this avoidance reduces their anxiety, certainly, but unfortunately, it only serves to reinforce the notion that the trigger or the situation is dangerous. Exposure therapy is an evidence-based intervention. If done properly, it is very effective in reducing distress, anxiety, and overcoming fears. Exposure therapy can help improve functioning as well as promote a sense of mastery and control. The goal of exposure therapy is to help people to face their fears. It's used to tackle avoidance due to distress and anxiety. The process of facing fears is called exposure, and exposure therapy involves identifying and then gradually and repeatedly going into feared situations until you feel less anxious. It works through a process called habituation. By exposing ourselves to a feared situation and remaining in it, our anxiety naturally reduces. So, our client's response is modified through exposure and habituation to the feared but relatively safe situation. Through graded exposure and the use of grounding techniques, the association of the trigger or the feared situation and danger is reduced. Like all occupational therapy processes, exposure therapy starts with building rapport. I'm not going to belabor this part of the exposure therapy process because as OTs, we're already experts at establishing rapport. It is important to provide clients with education that includes an introduction to exposure therapy and the role of occupational therapy. Also, a discussion of the anxiety avoidance cycle and so forth, so that clients have a good idea about what to expect and have a clear understanding of how exposure therapy can help them to break the distress or anxiety avoidance cycle and to function better. Prior to actually doing exposure, clients need to develop some coping skills and learn some grounding techniques to help them before, during, and after the exposure and overall in their daily lives. This may include deep breathing, distraction, using a touchstone or grounding objects, relaxing scents, sour candies, strong gum, and so forth. The goal is to provide the client with the tools that they need to remain in the situation or with the trigger until their anxiety or distress is reduced. Because this level of heightened emotion consumes a lot of energy, at some point the emotion loses its potency. Once a client has begun to develop strategies to help them manage their distress, then it's time to work with your client in generating a list of fears or anxiety-provoking situations, places, objects, and/or people. If it's a situation that causes distress, have the client list things like the who, what, where, and when. Situations may be further broken down into steps that can be done with mild distress or anxiety, and those that are associated with more moderate or severe distress. Start with the perceived easiest activity, the situation, place, or object, or the step that causes distress but the least amount of distress. Exposure therapy requires planning and patience on the client's part and on your part. Exposure exercises need to be well planned in advance so that the client feels more in control of the situation. Spend some time working with the client to outline what they're going to do, where, when, and with whom. The client's confidence is built over time, and it's essential to avoid them feeling overwhelmed. So start by addressing a trigger that the client feels they can tolerate and gradually work up to facing things that cause a great deal of anxiety or distress. If they're seeing one, I would highly recommend that it's a good idea to include the client psychologist in the conversation and to get their comments on the distress hierarchy, and the exposure plan. I found that the psychologists are able to offer valuable insights and comments, and they can also help the client feel capable of starting to tackle their distress. A good place for clients to start may be thinking about or imagining that they are in the feared situation or that their trigger is present. In the initial stages, exposure therapy may be looking at photographs. Together, you and your client discuss their reactions and their reactions and practice grounding techniques. Remember, exposure should be planned, prolonged, and repeated. The pace needs to be manageable for the client. It's important that we avoid the client experiencing levels of distress or anxiety that are overwhelming. The subscale, which I'll talk about next, will help with this. It's a really useful tool for building the fear hierarchy, for communicating with clients, and for preparing for and engaging in exposure. So this next slide represents the subjective units of distress scale, or the subscale. As I noted, it's a really useful tool. It helps clients set a fear hierarchy, communicate the intensity of their distress or anxiety, and it also helps with monitoring progress. Before, during, and after exposure, the client will rate their level of distress from 0, no fear, to 100, extreme fear, so the highest anxiety or distress that the client has ever felt. During exposure, the ultimate goal is to have the client remain in the feared situation or to continue to engage in a specific activity until their level of distress drops by about 50%. So if a client's distress starts at 75, we would ideally want to have them remain in the exposure situation until they report their SUDS to be around 35 to 40. At minimum, distress should come down to the point where they are uncomfortable, but they can function, so around a 50. Following exposure, and before you end your session, you want to check in with the client about their SUDS. They should be observably calm, and they should have a plan that involves unwinding after the session. In addition, they should have planned a relatively relaxed rest of their day. You'll want to have a talk with them about the experience and what they learned. You also want to make sure that the discussion includes a summary of the progress that they made so that we can help reinforce all their hard work and effort. Before ending the session, it'll be really important to assess for any increased risk of suicide and to have a safety plan that can be initiated if required. Although, if done properly, exposure therapy, the risk of increasing the risk of increased suicide is quite low. Once they are able to engage in a certain exposure on several separate occasions without experiencing much anxiety and no interference with functioning, say 30 or below on the SUD scale, they can move on to the next item on their ranked list of fears. Another key element in this intervention is to have clients reward their behavior. Encouraging positive self-talk such as, "I did it," is important, and you may want to suggest that they identify other rewards for themselves, such as a fun activity or a small special gift that they get for themselves. It's important that clients practice on a regular basis. The more practice, the faster the fear will fade. It's also important to maintain any gains by continuing to engage in the exposure from time to time so that distress doesn't creep back in and lead to further avoidance. Finally, tracking progress is important, and the subscale can help. As occupational therapists, we know the value of clients being able to look back and see how far they've come in terms of motivation, increased confidence, and a sense of purpose, as well as a host of other positives. So to sum up, exposure therapy is an evidence-based intervention that, when properly done, has been demonstrated to be very effective in treating anxiety and PTSD. Exposure therapy is one of the most researched interventions for PTSD. It's been studied in dozens of randomized controlled trials, and more are in the works. Meta-analyses suggest that exposure produces large treatment effects with respect to PTSD symptom reduction, as well as loss of the diagnosis itself. So I hope that I've been able to shed some light on exposure therapy and to provide you with some practical information that you can use in your practice. Thanks so much for listening, everyone. Take care.